Welcome back, everyone. Dr. Nancy Siatkosky is with us today from Lima Memorial. She's a doctor of physical therapy there, and I'm very excited about this because I've heard of dry needling. I know it's a thing, and I know you guys are doing it now. Tell me, first of all, what is that? What is dry needling?
So, dry needling is a treatment. It's kind of one of the tools in our belt for helping take care of musculoskeletal problems. So first of all, the dry needling just refers to the fact that there's no medications used. So different than if you're getting a cortisone injection into a shoulder that's got medication in it, or a vaccine that would have medication. So it's just a very fine, very, very thin monofilament needle. And that needle can be injected into soft tissue that's irritated. So if it's inflamed, if there's a trigger point, unhappy tissue. And although it seems strange to say, here, let's stick a needle in something that's not happy and try to make it better, it works that way. So the needle, when it goes in, it creates a little bit of a lesion to the area. And once that lesion is created, it starts a process that helps the body to self-repair, self-heal, if you want to think of it that way. And it leads to just improvement in the tissue. So the needle can be stuck into trigger points, or something people are kind of familiar with, like up in the upper neck. We do so much, typing at computers, seated, leaning forward, and you can get tight back in your neck. And so that's kind of what a typical trigger point would be. And so we can needle right into that trigger point, but we can also needle into ligaments, into tendons, into scar tissue to help with scar tissue if something's bound down in an area. And we can even trigger or needle right down into the bony area. It's called periosteal pecking, so the skin that's over the bone, and it can help with some conditions.
I love that idea. Very specific. Now, I think of acupuncture, too. Is dry needling a little more specific? As you said, it can get right to that area that needs it.
So dry needling is very different than acupuncture. So acupuncture is a traditional Chinese traditional Chinese treatment that is used to treat a lot of the same conditions, but it's utilizing a very different system. They're following meridian pathways and freeing qi, or the energy forces within the body. Versus dry needling, we really are targeting more the soft tissue type areas.
Love it. Now, someone comes in for dry needling. Maybe it's their first time they've ever done it. Kind of walk us through what happens.
Okay, so a physical therapist would be doing a comprehensive evaluation. So it's different than, say, if you were going in just to get a massage from a massage therapist, where you can just go and get it done, walk out and leave. So with this, you do need a prescription from a physician or nurse practitioner, healthcare provider. And once we get that and we see you and we do a full evaluation, so looking at strength, range of motion, posture, balance, talk to you about what's been going on with you to see how we can help you. And then dry needling is one of the things that we can use to help treat a condition.
It sounds like a wonderful option. As you said, they can give you guys a holler and set up a consultation and go from there. Doctor, thank you so much. We appreciate it.
You are very welcome. Thank you so much.
You bet. Nice chatting with you. And we'll be back right after this.